Hi, I'm Dr. Molly McHugh. I'm an equine veterinarian here at the University of Minnesota.
Hi, my name is Krishona Martinson, and I'm the Equine Extension Specialist at the University of Minnesota, housed in the Department of Animal Science.
Hi, my name is Emily Glunk. I'm a PhD student in equine nutrition working with Dr. Krishona Martinson here at the University of Minnesota.
Today we're going to talk about taking some basic vital signs in your horse. This can be important if you are in an emergency situation or you're concerned about your horse's health and you want to try to communicate some information to your veterinarian before they arrive to look at your horse. Typically, one of the first things that we do is actually look at a horse's respiratory rate. And one of the reasons that we do that first is that often when a horse is anxious or uncomfortable, their respiratory rate will increase. So the best way to monitor respiratory rate and to take a respiratory rate is actually to be standing outside the horse's stall before the horse is caught and take a respiratory rate at that point in time, because that's going to be a reflection of what the horse's normal respiratory rate is. So when we take a respiratory rate, you can see here that I'm standing a little bit away from Belle. Again, she's already out of the stall for this demonstration, and typically we do this in the stall. So the easiest way to do a respiratory rate is actually look for abdominal movement. And so thoracic movement in the horse is not as obvious as abdominal movement when they breathe. So the easiest place to see the respiratory rate again is by looking at the horse's abdomen. So if you're focusing on this area of the abdomen here, typically you can see the abdomen moving as the horse is breathing. We typically give respiratory rate and number of breaths per minute. The easiest way to calculate this is actually to time for 15 seconds, count the number of breaths that occur in 15 seconds, and then multiply by 4. We'll give you a number of breaths in 60 seconds. It's a little bit less accurate than counting for an entire 60 seconds, but it can be difficult to do that, especially if the horse is moving. So if we look at Belle, her respiratory rate now is really around 12 to 16 breaths per minute. So typically horses are going to have less than 20 breaths per minute. If they're excited, the respiratory rate often increases. And so if you're looking at a respiratory rate that's greater than 20 breaths per minute, we would typically step out of the stall, give the horse the opportunity to actually calm down and take the respiratory rate again, and before determining it was abnormal. If the respiratory rate is consistently over 30 to 36 breaths per minute, we would call a veterinarian. The next vitals that we normally do at this point in time, we would be walking into the stall and actually catching the horse. And I typically start at the front of the horse. So things that I'm looking at when I'm at the front of the horse is basically attitude is very important. So does the horse seem depressed? Does the horse seem anxious or painful? That's probably a big indicator of what's going on. The next thing that I do is actually look at the horse's mucous membrane. So when we're looking at mucous membranes, we typically look at the horse's gums. So we're looking for 3 things. The first thing is color. You can see that Belle's mucous membranes are nice pale pink. The second thing is actually the amount of moisture in the mucous membrane. So a normal horse's mouth is going to have some moisture. And the last thing is a capillary refill time. If we can get Belle to cooperate, what we're going to do is put our thumb on her membranes and press down to blanch the membranes and then release. And they should turn back to their normal pink color within 2 seconds. So we can typically also feel the pulse. There's an artery that runs under the edge of the jaw on both sides. And with a little practice, you can pick up a pulse there. Another place is there's actually an artery that runs here behind the eye where we can pick up a pulse. The other way that we take heart rate, and typically the way that's easiest or most accurate for horse owners, is to actually listen for a heart rate. The horse's heart rate is most easily auscultatable from the left side of the horse. While your veterinarian is probably going to listen to the heart both on the left and right, they're actually listening for more than just heart rate. But for horse owners, what we're really interested in is in heart rate. What we want to do when we're auscultating is kind of get to the place where the heart is going to be the loudest, because it's going to be most easy to hear the heartbeats. And so typically if we can get her to step forward just a little bit, put her left foot in front of her right, we want to basically get our stethoscope kind of up here right behind her shoulder. And again, similar to respiratory rate, the easiest thing to do is to auscultate for 15 seconds, count the number of beats, and then multiply it by 4. So we would listen to her heart rate in this area. One of the things that's often difficult for people when auscultating horse heart rates is to recognize that their heart rates are often very slow. As low as 32 to 48 beats per minute is pretty normal. So there's a long amount of time between heart sounds, and people often count 1 or 2 heart sounds as 2 heart rates or 2 heartbeats instead of 1, and miscalculate the heart rate. The other thing that's difficult about horse heart rate, unless you're used to listening to it, is that horses' hearts are so big, we often hear 3 or 4 heart sounds that are associated with a single heartbeat. So while it's good to learn to practice, or learn to take a heart rate, it's really important that you practice with somebody who knows what you're listening for. Okay. Another thing that your veterinarian is probably going to assess is your horse's hydration status. So especially if they're colicky and they're dehydrated, it's important to know. One of the things that is going to be an indication is if the mucous membranes are really dry. So we talked about that when we were looking at Bell's mouth. Another thing that we sometimes do is something called a skin tent. And so basically we take a pinch of the horse's skin over their neck and then release it. If a horse is normally hydrated, the skin should be elastic and should return to its normal shape. Sometimes in very old horses and very young horses, it's difficult to interpret the skin tint. Another place that sometimes people look at skin tint is actually to do a skin tint on the eyelid. Most horses won't tolerate that, but it actually can be more accurate than the neck. Another reason that we're often assessing vital signs in horses is because we're concerned about colic, and so we'll often listen for gut sounds. So gut sounds are, again, something that really listening to often is going to give you an idea of what's normal or what's normal for your horse. And we are interested sometimes in knowing if they're increased or decreased. Either situation could be symptomatic of colic. So when we listen to the gut sounds, what we normally do is listen to them in 4 places, or we call them 4 quadrants of the abdomen. So both on the left and right side of the horse, we're going to listen on the upper side and upper part of the abdomen and the lower part of the abdomen. Okay? It's important to understand that horses actually have a very large lung field. So really when you're listening to gut sounds, we're just listening in these 2 places on both sides. We encourage people to listen for at least 30 seconds on each location to have a good idea of the level of gut sounds in the horse. Another thing that's really important to remember, and is probably a misnomer, is that if a horse has gut sounds, doesn't mean that the horse isn't colicking, and even if the gut sounds sound normal, if the horse is acting like it has abdominal pain, it still needs to be seen by a veterinarian. I think people often believe that auscultating normal gut sounds means that they shouldn't worry, and that's not the case. We would walk around and do the same thing on this side of the horse as well. The last thing that is important to do is to take your horse's temperature. And so in a horse, we take a rectal temperature to get an idea of what their core body temperature is, and Emily's going to demonstrate. It's important to recognize that you want to make sure that you're safe and the horse knows that you're intending to take a temperature. So we take a thermometer, typically a digital thermometer, because they're give a readout pretty quickly, and insert the thermometer just a couple inches into the rectum. Normal rectal temperature in a horse is typically between 99 and 100.5. We don't really consider it a fever unless it's greater than 101.5. It's very rare that we would have a horse that has a true rectal temperature that's less than 99 or 98.5. Typically when you get a reading, that is because you actually have taken the temperature of a fecal ball and not your horse. So it's important to, when you put the thermometer into the rectum, to kind of have it to the side of the rectum so it's actually against the rectal wall. And it's also important to remember to be gentle because rectal mucosa is a sensitive tissue. So just to review, there's a couple of things that are important to remember. One, knowing what your horse's normal vital signs are is important, and you need to practice, particularly for taking an accurate heart rate or having an idea of what normal gut sounds are. Again, horses typically have a respiratory rate that's between 12 and 16 breaths per minute. Sometimes it can be as low as 8, especially if the horse is athletic and very fit. We always take the respiratory rate first, and we do that outside of the stall. It's the best way to get an accurate measurement. If it's greater than 30, consistently, you probably should contact your veterinarian. The second thing that we look at is mucous membranes. They should be light pink, they should be moist, and the capillary refill time should be less than 2 seconds. This is another thing that you have to practice because how hard you push against the mucous membranes can change capillary refill time. So it's most important that you do it consistently the same way every time. Heart rate is typically between 24 and 36 beats per minute. Can be as high as 48. We would consider that normal. If it's over 52, typically we suggest that you call a veterinarian, particularly if that's persistent. And finally, gut sounds. While there's something that is important to know what's normal, and you can make some kind of judgment about whether they're increased or decreased in your horse, just remember that because they're present doesn't mean that the horse isn't colicky or not having a problem if they're showing other signs that would indicate colic. Again, normal rectal temperature is usually between 99 and 100.5. We typically don't consider it a fever unless it's more than 101.5. If it's greater than 102, you probably should contact your veterinarian. On the other end of the spectrum, temperature is rarely less than 99 unless a horse is in severe shock. And so if you're getting a temperature that's less than 99, it's most likely that you need to improve your temperature taking technique and make sure that you don't have your thermometer in the middle of a fecal ball. And finally, hydration status we really look at. Part of that is that they have moist mucous membranes, and the other part was that they have a normal skin tint.